Hello, everyone, and thank you for attending today's webinar, The Future of Healthcare, How Houston Methodist is Reinventing Patient Care with a Touchless Experience, presented by DocuSign. I'm Jennifer, and I'm your moderator for this webinar. Our speakers today are Michelle Stansbury, Vice President of Innovation, Houston Methodist, Christina S. Wong, Senior Product Marketing Manager, Regulated Industries, DocuSign. You can find their full bios on the left side of your window by selecting the Speakers tab. Just a few technical notes before we begin. If you'd like to download the slide deck, please click the Handouts tab button on the left side of your screen. The webcast is being streamed through your computer, so there's no dial-in number. For the best audio quality, please make sure your volume is up. This webinar is being recorded and will be available on demand within 24 hours after the event. Time permitting, we will follow the presentation with a Q&A session. Please submit your questions using the Question and Answer tab on the left side of your screen. Okay, now let's begin. Christina, please go ahead.
Thank you. Good afternoon, everyone. My name is Christina Wong, and I'm with DocuSign. So I'm here today to really talk about the future of healthcare and how Houston Methodist is reinventing patient care with a touchless experience. As we adapt to the COVID-19 crisis and the changes that it's created, one thing that we've seen is that the healthcare community is really rising to this challenge. And one way that they're rising to this challenge is that they've actually reached out to technology providers like us, like DocuSign, to work in partnership so that we can solve some of these challenges together. And together, we're striving to find some technological solutions to help ensure that patients receive the care that they need while staying safe by providing a touchless experience. So it's clear that the healthcare industry is at a very pivotal point right now and having to make sustained changes. This quote here by the New England Journal of Medicine states that in face of the COVID-19 outbreak, Americans are waking up to the limitations of their analog healthcare system. It seems clear that we need an immediate digital revolution to face this crisis. And that's what we're here today to talk about and learn from Michelle Stansbury, VP of Houston Methodist's Innovation Hub, because she is working on trying to create this digital revolution and making this a reality for us. So before we dive in to hear from Michelle, I'm first going to do some brief introductions about DocuSign, spend a good amount of time hearing from Michelle, and then I'll close up with some remarks about how DocuSign is meeting the current crisis and the changes that are happening and how we're trying to adapt to those changes, wrap it up with some next steps, and save plenty of time for Q&A. So just a bit of an introduction on DocuSign. So I think some of you have known DocuSign as the leader of e-signature, but we are actually quite broader than just e-signature. We really believe that we are working towards transforming the foundation of the way business is being run. And at this foundation is really about the paper, or in essence, agreements that need to be signed, and they also need to be prepared. There's a lot of preparation that happens before this signing. Maybe it needs to be acted on by getting it through different people, or having payments a part of it. And then it has to be managed. And our vision of this digital sort of agreement process is that this is automated, and these contracts and these agreements are smart. And when you think of paper, this can be anywhere from informed consent to HIPAA releases or BAAs. And we really believe that there is this way that we can help digitize the experience for all. We have over 667,000 customers, and we've just been growing very rapidly. And we've been in healthcare for a long time. We have some of the best thought leaders as our customers, with over 1,400 healthcare providers using DocuSign. more than 100 health systems, and some of the leading healthcare ecosystem players are also with DocuSign. And on average, they're very satisfied. We have an NPS score of 66. So before I turn it over to Michelle, I just want to do a quick poll just to get a sense of what's top of mind for all of you. So if you wouldn't mind just saying what are your top 3 general initiatives that you're really focused on as an organization, that would be really helpful. As you can see, we have a bunch of different things that we've heard, from maintaining your EHR platform, COVID responses, boosting elective procedures, regaining patient volumes, transitioning to telehealth, stabilizing profit margins, staffing, digitizing patient admissions, and then other. So I'm kind of seeing here, just give another few seconds for people to respond as they come in. Okay, I'm going to move it over. So it is very, I would say this is very diverse, more diverse than I usually see, and very helpful. And I think what's great here is that we will be talking about digitizing patient admissions pretty thoroughly, as well as moving to telehealth. So let me now turn it over to Michelle, Vice President of Innovation at Houston Methodist.
Well, thank you very much, Christina. I'm so happy to be joining this session today. And looks like from your polling results, I think pretty much all of our healthcare systems, I think, are worried about the same things, especially given where we're at with COVID and kind of trying to move forward in our health systems. Let's see, there we go. Okay, I'm just going to move to the next. So just a little bit about Houston Methodist. We are an 8-hospital system. We have a physician organization, a research institute. We just celebrated our 100-year anniversary last year. A little bit about just the awards and rankings that we have within the organization. But most importantly, I think everyone has seen that as the digital health technology has gained movement, probably in the last couple of years, you know, Houston Methodist was no different than any other organization, and really looking at what are those forces that were changing the way that we do things. Rising healthcare costs, technology at the center of all of our daily lives, changing consumer expectations. And the one thing that we said to ourselves, like probably many of these companies didn't realize in the beginning, was if you're not ready, you will be disrupted. So if you look at all of the changing factors that have been going in within healthcare in these past couple of years, and the new entrance of organizations who had never been in healthcare before, we knew we had to do something, and we definitely knew that we wanted to disrupt ourselves and not be disrupted by these other organizations. And I really love this quote here from Charles Darwin. It's not the strongest of the species that survive, nor the most intelligent that survive. It's the one that is most adaptable to change. And I think that's what all of us are going through, just forces of change that we know that we have to do, or we will see others come into this market. So what did we do as an organization? We probably about 2.5 years ago, there was a group of us that just started meeting and talking about what are the things that we were seeing in healthcare. And like any groups that form within an organization, we decided our Chief Innovation Officer decided, why don't we name ourselves? While we officially became the Center for Innovation Individuals, we named ourselves DIOP. And DIOP really stands for the Digital Innovation Obsessed People that we are. And so what we did was we took a look to make sure that we had representation from all areas around the organization, from not only operations, but IT, our physician organization, marketing, legal, and so on, so that we could have a well-rounded group and breadth of knowledge coming in here. The other thing that we did that we found that was so important when we were looking out at other organizations who had created these centers, most of them were separated from the organization and doing really great work, but they were having trouble operationalizing their ideas. So every one of these individuals that sits on this committee also has a dual role. So our Chief Innovation Officer, which is Dr. Roberta Schwartz, she's also the CEO of our largest hospital. Myself, well, I'm the Vice President in Innovation. I also am the Vice President within IT. And the reason that we did this was whatever that we pilot, we wanted to make sure that we could quickly turn around if it was successful and operationalize it within our organization. A few guiding principles for us was innovation is everyone's responsibility. Of all of our 26,000 employees, it's not just these individuals that sit on the committee. Whatever we do has to transform the way that we do our business. We do research and development and embrace new technologies that we believe will create that transformation for us, and we have to be agile. So we either succeed fast or we fail fast. So this is kind of just a semblance of a portfolio of what we're working on. This is what we tend to guide ourselves on. What you see in that top quadrant are graduates, and I'll just talk about a few. Well is a text-based system that we use with our patients. Circulation is, of course, a list. Mia is a bot that we have that sits on our website that has tremendously helped us with hiring, especially with nurses. Going over into our pilot mode, Syllable, again, is another type of chatbot. TytoCare, if you haven't seen it, this has really been helpful for us in our virtual. It's a device that gives connectivity to so that physicians on the other end can see what's in your throat, can look in your ears, take your temperature, your blood pressure. I'll talk a little bit about this a little bit later on, but with Amazon and Alexa's within our room, we've had tremendous results with that. Within our pipeline, as you can see, there's many different areas that we're focused on, from our revenue cycle, intelligent locations, and really the CRM and our wayfinding is a way to be able to help know our patients, because they have this know me mentality, as well as being able to digitally be able to show them how to get through our organization. Clear, if many of you are, yes.
So this is such a great portfolio here. And I know when we've talked about this portfolio, you talked a lot about how you've been able to build this by focusing on some of your key problems here. And I was just curious about if you wanted to share a little bit with the audience around that sort of process that you went through in building this portfolio and making sure it's really focused in on Houston Methodist's key problems.
Sure, you're absolutely right, Christina. And, you know, I tell this to many individuals when they're really trying to focus in on what technology and innovation, you should be focused in on what problems you're trying to solve within your institution. And if you look at many of these are how we're creating that digital front door for our patients. And so that's what you'll see in a lot of these, whereas Well, CareSense, Mia, most of these, and in the pipeline on the revenue cycle on the back end, Tonic on another one. And I'll really talk to how we're and kind of moving forward of just how that has been helpful, again, with your organization and what we're trying to create. So I just will kind of on this bottom quadrant, we do, when I talk about succeed fast, fail fast, we have had our failures, and we do go into them as truly, we call them our rest in peace. But we try to learn from what those failures were. And, you know, one of these, I will tell you, we're already started with another vendor, but we've learned from what went wrong with the other. So I just want to go into this piece on our Center for Innovation Technology hub that we created. Because not only did we create this Center for Innovation group, we truly believe that we needed a true technology space where we could do that true R&D. And so our technology hub really has a home of the future, outpatient clinic of the future, an inpatient room, and really our kind of retail space. It also has a space for our partners to come in and do joint development with us. But one of the things that this technology hub, we had to quickly convert it during COVID so that we could train our multiple clinicians on how to do virtual care. Because at the time before it, while we were doing some, we were not fully scaled like we had to when it came to COVID. So it's been a great space for us. But I kind of want to go into this next slide which is really just, and I know it's got some animation, so hopefully it's going to work here. But really, how did we envision this transform experience? If you stop and think about your patients, right, they're wanting you to help them now. They don't want to have to wait for any type of help that you give to them. And definitely they want to make it easy. And because if you don't make it easy, you don't make it intuitive, they will go elsewhere. And they also want you to know them. They don't want to have to repeat their information every single time that they come into their institution. So one of the ways in that we looked at this was our sort of guiding principles into this vision of this transformed experience was convenient care anytime, flexible and easy scheduling, and digitally engaged patients. As you all know, everyone has their smartphone now, and they use it for their everyday life. They want to be able to seamlessly check in and follow up on any processes. We need to make this in a clinical, efficient workflow, and also we have been experimenting and looking at how we can do free prescription deliveries for these patients. And they want you to remember them. They want that enhanced communication. Remember where I talked about text-based communication? That's been extremely beneficial for us. They want data transparency. They want to be connected to that health system and truly have that physician-patient relationship. So here comes this vision. This is where we as an organization, when COVID hit us, of course, we know all patients, they could not come to the institution. We all had to do virtual care a lot more than what we were used to. But as things started opening back up, we knew that patients were leery about coming into the healthcare institution. They didn't know if it was safe for them to come back there. We all know, we've seen kind of data and stats where people are delaying care, which we know is not good. So we started talking to ourselves about how could we truly create this touchless vision for patients getting services from Houston Methodist when they had to come in. So we kind of took it in big buckets, right? How could they search? What is, the similar experience that they would have going through all of our institutions? How was that digital front door that they were looking at, making it easy and intuitive? How could they schedule? What was the self-prioritization features? View available and appointment times for things that they were looking at, plus making it geolocations where it is that it was convenient for them. And then any pre-appointment things that they needed to do, such as questionnaires or travel screenings, e-signatures. And then when they arrived, what were those self-service capabilities? And then the positive patient identification. Remember, I talked about CLEAR. And then, of course, there's the visit. How can they come in? How can they get out seamlessly? And then the checkout, how could they do it with a no-touch? How are they getting their payments done? How can they schedule future appointments without necessarily having to go through a desk? And then on the post-visit, yes.
When you're creating this vision, and it's very comprehensive, are you looking at particular KPIs when you're trying to build this out and say, hey, this is really key for us in this way, and particular KPIs that you think people should be looking at when building out this vision?
Well, it's a very interesting question. We haven't gotten to it at that point. I mean, I think we would look at, when we're creating this, of getting the feedback from our patients. I mean, as I said, one of the things that I know that we have clearly heard is that there is concerns from coming into our organizations. Is it safe for me to be there? They know we're taking care of COVID patients, so what can I expect? You hear over and over again on news and everywhere about how be very careful about touching things, be very careful about wearing your mask. And so for us, it's on this piece, what could people do prior to coming into the institution without having to technically really sign or create things while they're there at the institution? So think about a process today that most organizations, when a patient has to come in, a lot of times they're signing into the front desk. They're having to pick up a pen or do something to sign in. They're also having to fill out questionnaires, potentially if they're going to a specialty clinic, physician office, or they're having to make payment. Stop and think about all those touch points. And then it was, how could we eliminate those touch points that potentially you're doing most of it through your smartphone? So,
and that's very interesting too. is that a lot of our customers have mentioned as well that they're seeing decline in revenue because people don't want to have all those touch points that you're talking about. And so I think this is really neat that you're thinking about it in this way.
Yes, for us it was more, and I will tell you the big piece that we as an organization were very concerned about was the the level of people who were waiting to come in to get care and then come into our EDs. And we knew that if they had come in much sooner, they wouldn't be as bad as they were. But we knew people are waiting, and we knew part of that is because that they're just concerned about their security. And so part of this is just truly how are we ensuring that our patients feel good, that we care about their safety, and having them truly come in and get the service when they need it and not wait. So, I will tell you, we will definitely begin to look at, how are we going to measure the success of our program as we go forward. But some of the things that we have instituted, and you'll hear about this kind of in the next slide, is, we're getting some really high satisfaction rate from our patients on some of the things that we're already doing today.
And a question from the audience asked, the question from the audience asked, as part of this, how are you able to create a touchless positive patient IDs and how you're considering that?
And I will tell you that that's extremely important. And so one of the things that we're doing, we have not yet instituted yet. We're working through overall the implementation of it. Prior to that, I will tell you it's using a lot of MyChart functionality within overall Epic to know that we have the right patient. But I will tell you there's other identifiers that you can begin to use with other applications that we're looking at that will help you to make sure you have the right patient that can then tie back into overall into their MyChart, which then ties back into ensuring that you have the right patient when doing the right care.
Thank you for that. And I will also be touching a little bit upon some of the remote ways that we can help do some identification too as well. Thanks, Michelle.
Sure. So again, I'm just going to go to this next slide. As part of this touchless journey, remember I said that innovation was just not the responsibility of our DIOP group. We believe it's important for all of our staff because I tell you, it will be your frontline staff, it will be the individuals around the organization who will come up with these ideas. What you see here is one of our directors of patient access within one of our facilities was thinking again, how all of these forms and things that had to be signed. And so she came up and said, thinking about how can we collect patient signatures for all the registrations that are coming in remotely. She knew we were using DocuSign and was using this process and thought to herself and brought it forward, well, why can't we use this technology to help create this experience that we're talking about with touchless by sending all of this documentation over to our patients prior to them coming in, having them complete whatever it needs to be, then officially signing it by the technology within DocuSign and sending it back to the institution. So we implemented it over within that institution as a pilot. Remember what we do with an innovation, we pilot it first to make sure that it works correct. And I will tell you, it was a huge success. They've been sending out over, a little over 10,000 packets per month to patients who are registered for appointment to come in, who needed to fill out the documentation, complete it, and send it back. This helped that organization with their fast track process that they're looking at. They increased it up to about 50 to 75% fast track rate just by going through this process and using the DocuSign process to send to our patients and get those documents back. So tremendous advantage over, what we were previously doing before in trying to create that touchless experience.
And I think what's really unique here is that you managed to do this so quickly. I mean, tying it back to what you were saying around the fast pace that your organization is able to innovate, And I think you said part of it has to do with the dual roles that people play in your innovation hub, but do you mind telling us a little bit about that? Because usually for large organizations like yourselves, rolling something out within a matter of a month or so is not typical. Be great to hear a little bit about that.
Sure. It's one of the things that I will tell you, we've had a lot of people question, how do we get things done so quickly? And it really has to do with the dual roles that we hold within the organization. It's number one, it helps us identify what problems that we need to solve very quickly, hence the reason you see on this. Two, because of the dual roles, we understand the technology, we understand the operational areas, so we know what resources are needed and how to move it quickly through IT, which sometimes can be difficult, I know, in hearing from other organizations, to be able to create this process, have it go through implementation, and roll it out to an institution that now has the mindset of we need to implement this quickly to be able to see whether or not we're going to gain the benefits that we believe we will. So I will tell you, in a very, very short time frame, we were able to be able to pull this up. This is automatically generated out of our Epic system that then goes out over to the patient, comes back, and then we're able to store all of these documents back into our Epic system. So I will tell you that the benefits of that, if you stop and thought about a standalone innovation center coming up with this, trying to find operational resources, IT resources who are already so busy with what they're doing. Most of the time you're here, we'll get to it when we can. And 9 times out of 10, that could be 9, 10 months to a year before it ever comes to fruition. We've been able to turn things around within about a 3-month period of time, if not less. Because one of the things, again, I said to you is that we want to fail fast or succeed fast.
And is this because the disruption culture permeates in Houston Methodist, or is this something that you've had to create over time, this idea of we want to be a disruptor versus being disrupted?
I will tell you, it took us about a year to really ingrain this within the culture, but it really started from the top, from our CEO, Dr. Mark Boom. He firmly believed in this, and we ended up having different courses on innovation. What does it mean? What does it mean to me? How do I get new ideas out? And I will tell you, it's so much ingrained in our culture now that one of our institutions just recently, for many of you all, if you know Shark Tank, they had an innovation Shark Tank event. And it was for all of the teams to think about a problem in the institution. How could you come up with an innovative solution? And I will tell you, one of the things for any of our innovative solutions, they have to have a really true good ROI before we will do it. So to see, we've had about 10 ideas that have come out of that Innovation Shark Tank at just one of our institutions. And I think because of the success, it will probably be done at many of our other institutions within Houston Methodist. But that just goes to show you this culture of innovation and disruption, and how we know that we have to continually be looking at how we can improve, because what may have been an improvement last year has now just become the norm. So how do we keep disrupting ourselves in order to really stay ahead of where our competition is going? And all you have to do is look back at some of these organizations and the deep pockets that they have and how they're truly trying to disrupt healthcare. And they're not trying to build hospitals. That's not what they're trying to do. They're really looking at overall this outpatient side of the business, on things that they could be doing better. But also where I would tell you that's really, really important is for institutions to partner with technology vendors they know or new startups that are out there to help them along this process. Simply like when we partnered with you all on this process for this patient registration and how to get these documents, because you can't do it by yourself.
Thank you. That was great.
So let's just move on a little bit. Just I want to tell you, DocuSign, this wasn't the only thing that we're using DocuSign for. Here's all the other areas of where we're using this technology. it has been extremely beneficial in our organization and helping to streamline our business processes in these areas, especially even, you know, you stop and think, a lot of these are internal departments, but think about HR and all the documents that potential employees have to sign and everything before they come into an institution. So, you know, this is where it is that we have seen this technology be extremely beneficial for us. So just one last thing that, you know, when I talk about truly disruption, Houston Methodist truly believes that voice is the way of the future. I know probably many of you have some sort of device in your home that you use. How many times do we use Siri? How many times do we use other voice type devices? We now have Alexa devices in many of our patient rooms. They're being used to order food. They're being used to listen to music. They're being used to communicate with family members. But we're also looking at how can we create the effortless experience. We're using voice within our hospital ORs, with using ambient listening over in our physician clinics, using the device to be able to help from ordering pharmaceuticals. And so we have been partnering with a very large voice vendor who is helping us along this process. And truly, we are excited to know that we are making really great strides in overall this area because we believe this will be the next game changer. And last but not least, I'm just going to leave this on a note, and then I guess we can go into Q&A, is that success is not final, and failure is not final. It's the courage to continue that counts. Great quote by Winston Churchill, and I would tell you for everyone else on here, don't look as failures as something to shy away from. We in innovation believe that if we're not failing, we're not truly innovating. So Christina, I'll turn it back over to you. Do we have other questions?
Yeah, so we have a question here that says, how is this being presented to patients? Is this going out via email or in patient-facing applications? I'm assuming they're talking about the touchless patient journey and when you're going through a lot of that process. Is it going out via email or a patient-facing application?
It depends on what their preferences are. So I will tell you within my chart, those who are using Epic, you have a preference on your communication method. Ultimately, what they will do, yes, is complete them, send them through the DocuSign process. But if you have decided that you like text-based more than you like receiving emails, then our one vendor that I told you that we use that is text-based, they will send it through a text for you to log into the system to get to over all of these documents. If you prefer email, that's how you would get the notification that you have something to complete. And then you can log in and be able to get the information.
That's great.
So it's all based on what the preferences are of the patient, of how they have determined that they want to communicate with us.
It's great that you have all that flexibility. And then one thing that I know we've talked about that didn't come up during your slides was this focus on security that you have. I mean, you talked about bringing in Alexa. We're using DocuSign, which is highly secure. I mean, tell us a little bit about how you've been managing the security of bringing in this technology.
Sure, it's very, very important. I will tell you that we as an organization hold security about as high as anything else. And if you speak to some of our vendors, they would probably tell you that as well. We have a very thorough process that we go through. We have a data and security governance that we have to actually go in front of the committee and present whatever process that we're trying to create. They thoroughly then evaluate the security standards of that vendor and make sure that it is meeting the standards that we have as an organization. I will tell you, on some of our vendors, it's kind of held up the process until they can truly get into compliance with what our requirements are. But we believe that's very, very important. I mean, I think as you've seen, as many organizations out there, they've had security issues that I'm sure no one ever wanted. So we don't want any of that. We want to ensure that everything that we're doing is met with the highest standards. So even with voice, as you all know, Amazon just became HIPAA compliant here recently, not too long ago. So that helped us in that effort. But it's anything else that we do, if we can't get sign off by our data and security governance, then it's not something that we can move forward with. So luckily, DocuSign was within that category and was able for us to use that secure mechanism for communicating here.
Yes, we take security extremely seriously. That's actually why it took us so long to really get the groundwork that we have, because we spent so long in the early years doing all of that work on trust and security and legality. So why don't I go ahead and jump into my work in DocuSign and how we're viewing the future of a touchless patient experience, and then we'll wrap it up with more Q&A. We do have a lot of questions coming in, so I will definitely answer those after I do my section. So let me go ahead and put this up. So I really, after talking to you, Michelle, when I saw this picture, I was like, oh, this to me is really the vision of, do you want to be disrupted or be a disruptor? And I would say right now, I think in light of COVID, that a lot of us are feeling like this little girl getting hit by her older brother. I mean, being disrupted by COVID-19 and the challenges. And what we like to think about is how can we get our own pillow and counter this disruption that we might be facing and be a disruptor instead. And we can see that the vision that you've laid out for us and the tools that DocuSign has to offer, we can, with technology, give some power in order to be able to take control and be able to do some disrupting yourselves. And so DocuSign, we've had a history of disrupting. We like to think of ourselves as a disruptor in the space. Tom Gonzler started DocuSign in 2003 and registered the first company focused on this space, which is trying to disrupt the entire paper agreement process. And DocuSign was born as the first e-signature solution. And we were also, as you can see here, a bunch of industry firsts, but we were one of the first to have responsive signing so that patients and customers can have excellent experiences on their mobile device, and that we really have continued to innovate on security and on products, some of which I listed here that are just specific for healthcare. So as we're looking about bringing a touchless patient experience, we like to recommend that you think about investing in a technology that has a robust product suite, because it can help you adapt to whatever may come your way, and that it allows you to scale across your organization. You don't want to have a bunch of different technologies that are in different parts of your organization. You want to invest in a solution that could really scale and span. And I think what we've seen is that a lot of our customers actually start out with just the e-signature solution. It's a very premium product in which they really want to be able to launch this for not only security reasons, but let's say like what has happened with COVID-19, where you have to go maybe into a more robust telehealth solution than you expected. DocuSign was able to adapt because we are a premium e-signature product. But as you can see, a lot of customers actually take the journey that Houston Methodist laid out. They may start out with back office in health, in HR, but that they slowly realize that the power of having a digital agreement process, and that they expand into more patient-facing use cases, and that, as you can see, as the technology is able to scale across the organization. And for DocuSign, we really see the three constituents of your business that we can help solve some of their challenges is really around the patient, your employees, and clinicians. And when we're talking about employees, we're really talking about making their lives easier, gaining operational efficiencies, especially when it comes to security and productivity. So you'll see here that we have lots of different products to help you as an admin to have tight controls or to have SSO. And we also have a very strong contract lifecycle management solution that automates complex workflows associated with any of your supplier contracts. And I'll go more into some of our products as I go into specific use cases. So going back to how DocuSign was really able to help a lot of our customers create a touchless experience really came about when the COVID-19 crisis hit. It was a very unexpected influx of demand, mainly driven by this need for a touchless experience. So what you'll see here from the left is that we had a mobile app, TeleDoctor24, a behavioral health provider, and a fertility clinic, all needing to be able to either provide telehealth solutions or to be able to collect important consents before actually seeing the patient. And I think what's very unique around TeleDoctor24 and Engaged MD, which also came up in the Q&A, is that they actually really needed very stringent identity verification requirements to do it remotely. And DocuSign has a special product called Identify that allows us on validating identities virtually. So TeleDoctor24 and Engaged MD use this. Particularly TeleDoctor24 is a European company, and DocuSign meets the EIDAS requirements in Europe, which is a very stringent requirement. And so they use this for the qualified electronic signature regulations. So this also is countered by some of the unique things that we saw for larger hospital systems farther on the right. One healthcare provider in Texas set up a curbside COVID-19 testing site, and then patients used their phones and scanned a QR code to bring up the consent forms on their mobile phone, and then the patient electronically signed the forms using DocuSign. And then we also have a special product that's focused on making sure that it meets the requirements of the FDA 21 CFR Part 11 requirements for any regulated documents that needs to go through the FDA. So the hospital systems, a large hospital provider in San Diego, California, actually conducted COVID-19 clinical research at their facility and used DocuSign to make sure that that patient did not have to touch pens, and it didn't, make sure that the employees stayed safe. So these were all ways that DocuSign was used to create that touchless experience. And as we're thinking about this future of healthcare, we are really thinking about our products and our solutions around 5 key trends here that you see around economic uncertainty that we have, rising expectations to go digital, reconfigured delivery models. We know telehealth is here to stay. Having decreased total cost of care, this is really important as we see pressures on margins increasing, that we're really wanting to make sure that operationally that healthcare providers are becoming more efficient. And as we all know that regulation constantly changes, especially as we are in an economic an election year. And so when it comes to economic uncertainty, DocuSign kind of sees a digital solution to be able to help with some of this inequities that we're starting to see caused by COVID-19. On a PBS NewsHour on September 29th of 2020, they said that most low-income renting families spend at least half of their income on housing and utilities, while nearly a quarter spend more than 70%. And so this means that if there's a health crisis in that family, they're going to be less able to pay those hospital bills. And so what we've seen is providers need digital solutions around their HR. As you need to flex, being able to hire more nurses or staff, or maybe pare it down appropriately. And so being able to have digital credentialing that DocuSign can help with, or physician contracts and making sure that they are Sunshine Act compliant. These are all ways that you can use technology to help with that trend. And then focused around patient expectations, I think in particular, we've seen that a McKinsey report dated September 2020 stated that virtual care and outpatient options show more potential revenue growth at 113% CAGR through 2022. And so when you're looking at trying to provide these digital solutions, you have to make sure that they're compatible with your existing systems. DocuSign has more than 60% of our transactions are through our API. And we have a partner called Know2 that helps DocuSign be interoperable with EHRs. These are the type of solutions that you want to think about in making sure that they're compatible with your existing systems as the trend is going to changing your delivery models. And then lastly, I'll end on this trend point around decreased total cost of care. And that same McKinsey report in September said that the healthcare industry is suffering from a $70 billion to $100 billion outflow due to COVID-19. And that they estimate that the healthcare industry earnings can be depressed between $35 billion to $75 billion compared to baseline expectations. Yet that they expect the healthcare industry to have productivity and operational efficiencies estimated to be around $280 billion to $550 billion by 2028. And so the expectations are there that the healthcare industry will, as Michelle has hinted, be going the digital way and really looking at ROI and seeing that technology can really help here. And then lastly, I'll just point out for regulatory changes, the way that we're trying to address that is really through our AI solution and ensuring of our strong audit trails and our strong compliance pieces, and that making sure that employees are not having to spend months looking through contracts for key terms. So here, when we're looking at trends, as I mentioned, security is always very important. The more that we go digital, the more that you have to look at security. These are the main key pieces of and areas that DocuSign looks at when we think about security, which is around information security, audit and compliance, the actual physical security and safety, third-party supplier risks, and trust, making sure that when you're communicating, the employees understand some of the requirements that are needed. And then moving on to ROI, when you're looking at a technology solution, we also suggest that you really want to do a robust analysis of their ROI. And this is how DocuSign looks at our ROI. We do this for our healthcare customers. We will look at our technology and how we are helping, and we look at it by looking at the hard cost savings, the revenue upside, and productivity benefits. And for our healthcare customers, on average, we see that we save $9.38 per document, $7.21 reduction of hard cost per document, 50% increase in form accuracy and completeness, so that's really around productivity and also patient experience, and just generally more ease of doing business for your patients. Your employees are more productive, they're not having to rework things, and we have your ability to be able to comply with regulations easier. And then lastly, these are some suggestions that we also put together around when you're thinking about a technology provider and trying to create this touchless experience. As Michelle mentioned, there's a lot of entities that need to be involved and that you can't do it yourself. And so our customer success team has put together these 4 top best practices for implementation. And it's around creating a centers of excellence where you have an advocacy group internally to help overcome challenges. They also suggest that you create the process that's standard throughout your organization. You don't want to have your technology in one part of the organization operate separately than another part. And so having that standardization really helps to ensure that everything is consistent. Last, the third piece is that you want to be able to make sure that the technology that you have has the potential to have reporting mechanisms so that if regulations change or you need to retrieve data for reporting purposes, that you, to senior management, you have that capability. And then lastly, making sure that you tell your organization about the technology and the successes that they have, because really change management is one of the key factors to success, and that if people, you could have the best technology in place, but if people aren't using it right and they don't know how to use it or that it exists, that is a key component in making sure that you are on your road to success with any technology that you bring in. So just to wrap it up, I hope that you've learned a bit about how Houston Methodist has really used technology to address the future needs of adapting to what we have here with the COVID-19 pandemic and beyond, and that we've talked about how it's important that you think about being a disruptor instead of waiting for change to happen, that this really helps your organization be at an advantage long term. Third, that your technology stack can really help you address your margins and security and operational costs and enable you to scale and grow. And that it's really important to think about security and change management as really being a key to success for any technology implementation. So before we go to Q&A, I just wanted to make sure that you stay in touch and you keep the conversation going. We have additional webinars here that we have tiny URLs. First is on contract analytics and AI in healthcare on October 29th, and then more around privacy on November 5th. These slides will be shared out to you, so you can actually, if you forget the tiny URL, you can use the slides. So I will now turn it over to Jennifer to help us with the Q&A.
Thank you. Now let's move on to the question and answer. There's still time to submit your questions using the Q&A tab to the left of your screen. We have lots of great questions already, and we'll try to get us to as many as possible. So to start, there's been a couple of questions about whether documents and e-signing are integrated into MyChart, and if patients will be able to do their e-signing through MyChart.
So we send out, go ahead, Christina. Do you want to answer that?
No. You can, because I know that you've been working on that. That'd be great.
No, what I would say is that it follows, remember, everything has to come back over into our system. We don't necessarily keep the documents that are signed in questionnaires within MyChart. They are kept embedded within overall our Epic system that are on that patient's chart. So we don't necessarily always use MyChart to send those things. We send them through a process that then allows it to be generated out of Epic, but then comes back into Epic.
Okay, thank you, Michelle, for that. I just wanted to mention that we can also adapt to different ways that your MyChart might be working. We do have partnerships that can help with that, as well as looking into different ways that we basically are working with each hospital provider, and even I think LA Children's Hospital has created a custom integration as well. So it's definitely possible and doable.
Great. The next question is, when using DocuSign for contracts, do you undergo a signature authentication process?
Yes, we do. And I can follow up with more specifics on that authentication process, but it definitely, you have several options to include like an ability to double check their identity through a text message, or that they get a specific security code and that they have to put in that number before they are actually able to sign. So we have lots of different varieties of ways that you can authenticate that signature.
Okay, great. So our next question is about virtual visit vendors. Did you contract with a virtual visit vendor to provide enough virtual visits that were needed, or did you hire more providers to fill the need?
So from Houston Methodist, I will tell you for virtual urgent care, yes, we did contract with American Well, but we also used functionality embedded in with MyChart. So we used, again, for virtual urgent care, which is at night on weekends through Amwell, but then any other time we used the functionality embedded with Epic with our own physicians.
Our next question is asking, how are you addressing in-house patient communication with their loved ones?
So that's where, again, that I mentioned about the Alexa devices. We've also incorporated putting iPads in all of the rooms. We did it specifically for the COVID unit when COVID was at its highest peak. And that allowed for patients to communicate with their family members through that iPad in a secure manner so that they could keep in contact with them. It was so successful that now we're rolling it out to many of our other units at the hospitals, just so that, again, that the patients can, one, use it for entertainment value. They can use it we also have MyChart bedside, so again, they can order their food through that, through using the iPad, as well as using Netflix and some of the other things. So, but that was our communication method that we used.
Our next question, from a KPI perspective, is HMH tracking response times to patients to fill out and return the documents? And they want to know if that is important to understanding if the patient will follow through and show up for their appointment and will help to engage them.
Yes, I mean, our frontline staff definitely are following up. And as one of the things, as you can see, the goal is to really have all of the documentation and all items completed prior to that patient ever coming in. So they have what they call this fast track process. And so it created, and the efficiencies that have been gained by that, they've been able to free up staff that are not having to continually follow up with patients to get all of the information done by utilizing this process. So they went from about 50% complete to about 75% complete now using this fast track process.
Our next question is for Christina. Are DocuSign products GDPR compliant?
Yes, DocuSign, we are GDPR compliant, and GDPR is a regulation that came out in May of 2019 that codifies the EU citizen privacy rights and the defined roles and responsibilities of data processors and sub-processors on how to handle EU citizens' privacy data. So one popular way of doing that is through BCRs, which lays out how companies meet every requirement within the GDPR regulation. So DocuSign has outlined its BCRs and got them approved by the Irish Data Protection Commission. And as part of that, our customers are data processors because they own the data being requested and managed on behalf of EU citizens. So when a document is put in the DocuSign e-signature cloud and citizens are asked to fill out personally identifiable information, those data processors manage that data, and we store all that data within EU data centers, and only the sender or the signer has access to the data, And then once there's no longer a business need for that data, DocuSign has tools to help the processors redact or delete data upon the request from the citizen. So yes, we are very GDPR compliant.
Okay, our next question is kind of about the process of moving toward this. How did you guys start? Did you use a hybrid or parallel manner, or was it wholly electronic?
So are we talking about the patient access process? DocuSign?
I believe so.
So again, stop and think about what I talked about as far as an innovation is what we do. We create pilots. So we did a pilot within overall one of our institutions. And no, we of course tested it thoroughly before we put it in place, but it is in place. It's not a parallel process. There may be a few that don't get their documents signed prior to coming in, but it's very, very few. The whole point is to be able to have all documents signed, prepayments done and made prior to individuals coming in. So it was put in place for the institution as a whole.
Great. Sorry, we have quite a few questions. The next question is, there's so many vendors and technologies out there. What criteria is most important when determining the best solutions to solve for our top priorities?
I will tell you, yes, there are so many different technology vendors that you could get caught up in all of the hype. But as I said in the very beginning, one of the things that is most important is that you need to stay focused on what problems that you're trying to solve. The other is how easily is it to integrate with your EMR that you have in place. Sometimes it can be very difficult and not worth the time and effort that it would take for the integration piece. But really, number one, what problem are you trying to solve? Is it truly bringing the ROI that you believe that it will? And sometimes that is just creating the patient experience that you're trying to create. And then again, with the integration pieces.
Great. This will be our final question. We had a lot of great questions today and couldn't get to all of them, but we'll try to do our best to get back to everyone who submitted personally after the webinar. So our final question is, what are some of the best practices in change management that you recommend?
I would say you have to really communicate overall throughout the organization. You need to test. I can't stress that enough. And when you're trying to change behaviors as part of change management, it's really important that everyone understand the why behind the change.
And just
Christina,
to add,
others you want to add?
Yeah, I'll add. So other than the components that I mentioned in the webinar, one thing that we've noticed for change management that helps is also making sure that the technology provider can also provide self-serve pieces of information that can help them train their staff. So when COVID-19 first came about, our customer success team obviously helped the customers get up and running in a matter of weeks, but some of our smaller customers, especially when they have less than 25 employees, had to really utilize our DocuSign University tools. And one of the customers is Heart-Centered Counseling, where they trained over 200 providers through DocuSign University's guides and videos, and they were able to save valuable time when they transitioned to telehealth. So while bigger entities or organizations may want dedicated staff from your technology provider to help with implementation, also be sure that there's some self-serve resources as well.
Great. So I'd like to just thank everyone for attending this Fierce Healthcare webinar and submitting so many great questions. I'd like to thank our speakers for participating and DocuSign for presenting today's webinar. This webinar has been recorded. You will be able to access the recording within 24 hours using the same audience link that was sent to you earlier. Thank you again for joining, and we look forward to seeing you at future events. We do have some polling questions for you to answer at the end of this webinar. Please stay after to answer the questions.